Living with heart failure. Hello, and welcome to this video guide about living with heart failure. My name is Lillian, and I'm a physiotherapist in UHBW cardiac rehab team. In this video, we will explore ways to support you while living with heart failure, whilst thinking about how to manage your symptoms and worries. The information presented will include data from research and experiences from other heart failure patients. Overview. This video will cover the following topics: understanding heart failure, things you can do to manage looking after your mental health, and where you can find further support. If you have any concerns about your heart condition, please speak to your GP or cardiac team. There is also further information on our trust websites, as well as the British Heart Foundation and Pumping Marvelous sites. Understanding heart failure. Heart failure is a condition where the heart is unable to pump out enough blood to the rest of the body. This condition requires a treatment plan that could include lifestyle changes, medical appointments, and medication. Having heart failure may require significant lifestyle changes such as needing more support with daily activities. It is important to remember everyone's experience of heart failure is different. Some people can continue with only small changes to their lives, whilst others may need to make big adjustments. Things you can do to help manage living with heart failure. If you have received a new diagnosis of heart failure, you may have to make lifestyle changes or attend medical appointments. It is normal to have a range of feelings during this time, including the feeling of uncertainty. Here are some practical things you can do to help manage living with heart failure. 1. Keeping tracks of medications and progress. You may be taking a combination of medications to help treat your heart failure, and it can sometimes be hard to keep track. Taking right medication properly will help to control your symptoms, so it is important to try and understand what different medications do. It may be helpful to keep a record of useful information for when you see your health team, such as your symptoms, weight, and fluid intake. It may also be useful to record blood test results or blood pressure. 2. Making lifestyle changes. You may need to make some changes to your life because of your condition. This could involve getting help with housework or exploring other job roles. Change can be difficult at first, but most people adjust and cope well with these changes over time. Some activities you used to find easy may become challenging, so it is always important to set realistic goals and make smaller steps towards them. 3. Getting help and support from others. It is important to use friends and family around you for both practical and emotional support. Talking to loved ones about how you feel may be difficult, but being open and honest can help you with moving forward. Looking after yourself while living with heart failure. There should be a healthcare team around you to also help you look after yourself, both physically and mentally. Please continue to communicate with your healthcare team about what is important to you and any specific worries you have about managing your heart failure. It is normal to have a range of different feelings towards living with your heart condition, including anger and sadness. Recognizing the feelings and emotions that you are experiencing is the first step to managing them. Remember to consider your well-being and take time to look after yourself. Here are some things you can do to make sure you are looking after yourself and your well-being. 1. Talk about how you are feeling. Let a friend, family member, or someone close to you know how you are feeling. Voicing your feelings can help worries seem less overwhelming and more manageable. 2. Join a support group for people living with heart failure. It may help to meet other people who are going through the same thing and share your experiences with them. They will have first-hand information experience of the challenges that you are facing, which will help you to see that you are not alone in your condition. Thirdly, mindfulness. Whilst adapting to living with heart failure, it is vital to treat yourself with compassion. Try not to judge yourself for any negative feeling or difficulties, and remember that you are doing your best. Mindfulness can be a useful practice to help you remain present and prevent you from being overwhelmed by negative thoughts and feelings. For further guidance on mindfulness and self-compassion, please access our Trust websites where you can find guided exercises and other resources. Heart failure is challenging. Making lifestyle changes and managing medication can take a lot of work. It is important you acknowledge the hard work you are putting in to manage your condition. You may experience anxiety or low mood, particularly in your initial weeks after diagnosis. It is important you speak to friends, family, or your healthcare professionals if you feel as though you would like further support. If you have an urgent mental health concern, you should contact your GP who can refer to appropriate mental health support. You can also call 111 for mental health advice. If someone's life is at risk or you do not feel you can keep yourself or someone else safe, please call 999 immediately. If you are over 16 years old and you would like to accept support for your mental health, you can self-refer to your local IAPT service. IAPT also have self-help guides on their websites, which you may find helpful. A selection of further resources and support will also be listed along with this video on our website. Closing message. Living with heart failure may require changes in your lifestyle and leave you with a sense of uncertainty or anxiety. Remember that there are lots of further support out there from your GP, cardiac team, and family and friends. You do not need to do this all on your own, and working with teams around you can make a difference. Thank you.